Laughter has been seen by society as an important healing tool for thousands of years. Laughter is the best medicine is a phrase that has become a cliche exactly because of this belief. What we tend to forget is that it's a cliche because it is based in the truth. Thanks to modern medical research, we are starting to see exactly how true this phrase really is. This research is showing us that there are many physiologic benefits to laughter and humor. Not to mention the benefit that laughter can have on our stress and the relationships that we have with the people who help care for our health. Alice Pachente, in her article, Humor in Healthcare, Irreverent or Invaluable, lists some of the health benefits of humor and laughter. When somebody laughs hard and frequently, it can feel like they've exercised, and that's because it's actually working different parts of your body. The first thing that you'll probably notice is that it works your belly muscles. What happens is it causes your muscles to contract and relax repeatedly as you're laughing. It also works your heart. It's also called internal jogging sometimes because it raises your heart rate and increases your circulation. Now, a third thing that laughing can exercise may not even really be considered a muscle, but it helps exercise your respiratory system. This is the most noticeable in post-operative patients who sometimes have problems with breathing deeply. A belly laugh can help them breathe more effectively and much easier than if they were just trying to breathe on their own. Additionally, repeated belly laughs can actually help cleanse their respiratory system because it forces them to take a great big breath in and then exhale it completely. Now, laughter can also help increase your pain threshold. Now, this could be for a couple of reasons, both because it provides a distraction to the patient and also because it releases endorphins, which are natural painkillers that our body produces. Laughter also helps to activate the immune system in our bodies. Researchers have discovered that subjects that were exposed to humor have a higher level of activated T lymphocytes, which are important because they attack both cells that are infected with viruses and some cancer cells. They also found a higher level of an antibody called IgA, which fights infections in the respiratory system and the gastrointestinal tracts. Now, everybody knows that stress is a huge part of our modern lives, and laughing is a good way to help fight that. Joe Hoare points out in his article, The Best Medicine, that laughing decreases stress hormones like cortisol and adrenaline, as well as increasing the production of endorphins. He also notes that our brains are unable to produce both stress hormones and endorphins at the same time, meaning if we want to stop feeling stressed, all we have to do is laugh. All of the physiological benefits of humor and laughter are great, but how can the application of humor and laughter help assist those people that help care for us when we are ill? Well, researchers don't believe that doctors need to start telling jokes every time they walk into a room. However, they have observed that patients that are in an environment that incorporate humor and entertainment, there are benefits that go beyond the physiological ones listed above. Dr. William F. Fry, Jr., emeritus professor at Stanford University School of Medicine, in an interview with Jody Godfrey for the Journal of Women's Health, discusses how an increase of humor in the treatment process can actually make medication more effective. Those that were given medicine in an environment that incorporated humor actually needed less medicine over time than the patients that were in a traditional setting. The other result of a doctor who incorporates humor into his treatment is that he is more likely to have a patient that follows his plan that is laid out for them. This, of course, is going to increase the effectiveness of the plan that was laid out by the doctor. Now, you might ask, how are we supposed to fit more humor into our already packed lives? Well, Alice Pacinte, in her article, suggests using what she calls a funny folder. Now, she says to put in your funny folder anything you think is funny, so you have something to laugh at anytime you want it. She suggests things like cartoons, your favorite Sunday cartoon, your favorite sitcoms. Keep them so that you can watch them on TV whenever you want. You know, if you find a humorous quote that you like, put it in the folder along with the cartoons. If you have funny pictures of your friends or family, or even something that you find online, stick that in there too. And anytime you're at work and you're stressed, you can pull it out and have a laugh. Now, Joe Hoare's suggestions are to 1, look for humor in everything around you, instead of depending on somebody else to tell you a joke. His second suggestion is to fake a laugh. Our brains have a funny little quirk that means that they can't tell whether a laugh is genuine or fake. Now, that means that not only will a fake laugh trigger the same release of endorphins as a genuine laugh, but a fake laugh will almost certainly end up turning into a real laugh. Always laugh when you can. It is cheap medicine. This advice from Lord Byron is something that we could all use a little bit more of in recent times. While laughter won't replace modern medicine by any means, it is certainly an important addition to our overall health. Just a couple minutes each day can enhance your health and enhance others' abilities to help care for your health. It's an important part of our lives, and an enjoyable one.